Hey, welcome back. The GOP agenda going full speed ahead as the new Congress gets sworn in and sets its sights on reworking Obamacare.
The law isn't working. It is failing. It's nothing but a string of broken promises. We have to provide relief. We have to step in front of this chaos and provide relief for people. That is why we're moving to fix this problem. Our goal here is to improve people's lives. Our legislating on Obamacare, our repealing and replacing and transitioning, the legislating will occur this year.
So what will replace it? Here to break down the good, the bad, and the ugly of the Affordable Care Act is Fox News Medical A-Team's Dr. Mark Siegel. Doc, nice to see you.
Hey, Clayton, good to see you.
And you accept Obamacare from your patients. So let's talk about the good, because as you point out, patients want something in place. They don't want to have that gap where there's no coverage for them.
Absolutely, Clayton. And I gave as a first example a 60-year-old patient who was a carpenter who didn't even know he had diabetes till Obamacare came in. I saw him for the first time because he had the new insurance, found out he had diabetes, got him treated, but I wasn't able to give him the medication I really wanted because it wasn't covered, and I wasn't able to use the specialist I wanted who didn't take Obamacare. So we struggled along, and he got better, but not as better as he would have gotten. So there's the pre-existing conditions. Okay, it's covered, but you may not get the care you want because of all the excess regulations.
So pre-existing conditions is good. Also, what about those under 26
And I have an example of that, a 25-year-old who had a bad cough, who came to me, got treated for bronchitis. Guess what? If he hadn't been covered under his parents' policy, he might not have come to the doctor at all. Young people are notorious for saying, I hope that cough goes away. But meanwhile, here's a good point. If he gets over 26 and he's on his own, he may resent that policy he has to buy into now under the current Obamacare situation, which has got too many bells and whistles, which is not catastrophic, which is very, very expensive.
So that's what President-elect Trump has said he'd like to keep is the pre-existing conditions and those kids who are under the parents' plan.
Absolutely.
Now let's go to the bad. This is the reform area, and let's put these up on the screen here. What do you see in the bad that needs to be reformed? Inefficient Medicaid expansion?
Let's start with that. You know that it's up 49%. The cost of it is over $6,000 per person this year. That's a headline that's been buried. Medicaid is spiraling out of control. But in Ohio and Indiana, interestingly enough, Indiana, where Governor Pence was involved with this, in Indiana, it's cheaper because there's an efficiency model with up to 30% of doctors not seeing new Medicaid patients. We need nurse practitioners involved. We need physicians' assistants involved. We need business managers involved. It can't be the way it is now. So Medicaid has to be managed by the states with block grants, but let's keep the expansion.
And let's get to the ugly now. These are the things you want ripped out of here. So individual mandate conning young people into buying coverage they don't need, exchanges and high deductibles. Get rid of these.
Because under Obamacare, everybody gets charged the same price. Why shouldn't young people have catastrophic insurance available to them? That would help everything. That's number one. These exchanges are bloated and they're way too highly regulated. Clayton, you'll love this. In a Star Trekian future, your kind of a future, there's going to be a pill for you and a pill for me, and it's going to be different pills. Insurance, an Obamacare kind of insurance that says everybody needs the same thing, will not cover it. It's becoming obsolete now. We need to scale it back. But you know what? 2 years of transition to get rid of the exchanges. Right. It's not going to be the way the Democrats are saying, scaring everybody, there's going to be no coverage. President-elect Trump has said something is going to be in place. It's not about repeal only. It's about having something ready to go.
Dr. Siegel, great to see you.
Great
we
to
have
see
Governor
you.
Huckabee coming up next.